with males having probably a smaller lung than females. But there are new cases at any age. So you can start at age 30 or age 50 plus. The natural history is really not completely understood. And the number one question I'll frequently receive from the parent is, will my child grow out of it? I have a tough time if you think that just imagine yourself in the room and the child's there, and they may be doodling around or playing with their little video game, but they're really listening to every word that the parent and the doctor says. And I don't want to give them a complex, but the reality is most do not ultimately grow out of it. Certainly as they're larger and their lungs grow larger, there are less severe problems with it. And it seems that once you hit early adulthood, there are fewer problems. Here, we're going to go through asthmatic inflammation. And this is where Dr. Jacobson's going to take over and speak about the inflammation and start taking you through the guidelines. And I'll be back.
Thank you, Dr. Solar, for your nice introduction, and Stuart for yours, and thank you all for coming this evening. I'd like to draw your attention to the little diagram on the top left corner. It looks like the lungs are on fire. Inflammation is really the key when dealing with asthma. Inflammation leads to a variety of responses, hyperresponsiveness in response to triggers such as dust, allergens, molds, smoke, air pollution, things like that. It leads to obstruction. Sometimes mucus glands produce more mucus. There's edema and swelling of the airways. Usually this is reversible, at least partially. Symptoms of coughing, wheeze, and shortness of breath are hallmarks of asthma. It's to be noted that while the symptoms are easily appreciated, as it said, the symptoms are really not the problem with asthma. Inflammation is really the underlying key to understanding this disease. Let's see. Okay, here we have a diagram of the pathophysiology of asthma. What most people are familiar with asthma is the wheezing and the shortness of breath. That's related to the smooth muscles. There are muscles in the bronchial tubes that can constrict and narrow the caliber of the bronchial tubes and cause wheezing and shortness of breath. That gives bronchoconstriction, bronchial hyperreactivity to some of these triggers that I mentioned. Over time, you get hypertrophy or enlargement of these muscles, causing sometimes persistent abnormalities in the airways. It also is involved with the inflammatory mediator releases that we'll talk about. The airway inflammation, there are inflammatory cells that are drawn into the bronchial passages into the lungs. These release other factors that draw other inflammatory cells. It's almost a vicious cycle. You see edema of the airways, cellular proliferation, epithelial damage. Epithelial cells are the lining cells of the lung, of the bronchial tubes. In chronic asthma that is not, when the inflammation is not addressed, basement membrane thickening occurs and chronic disease can result. These pathways both lead to symptoms and exacerbations. This is a pathological slide of a patient with asthma. Do we have the laser pointer someplace? Oh, here we go. This is the epithelial lining. This is the lumen of the bronchus up here. These are the cells that line the bronchial tubes. This is called the basement membrane. This is thickened and abnormal in asthma patients with chronic inflammation. You see a lot of these round little forms. These are inflammatory cells that infiltrate the tissue in